Today we're talking about tumescent anesthesia lipo. There are many different types of liposuctioning. The type that I do incorporates multiple different modalities of liposuction. Over the years I've learned that adding a few extra steps gets you better results. So the 4-step process that I use is numbing, which includes tumescent anesthesia, which is just a bag of lidocaine which we inject into the patient into the area that we're going to do liposuctioning into. Tumescent anesthesia is basically diluted lidocaine, the same that you go to the dentist to get. It's just diluted so we can inject more of it. That's the first step. The second step is doing laser. So when we do laser, we use a very fine tip laser fiber. This is about 1 millimeter thick, and we go in and on the tip of this, basically going in and melting all the fat in the area that we're going to liposuction. So as you can see by this, is a very fine fiber made by Cynosure. I do what we call a smart lipo triplex. It's the newest form of smart lipo. The third step is what we call tissue breakup. If you can see this cannula zooming in on it, the tip is actually what we call an exploding tip. It's what we use when we go into the fatty tissue to break up the tissue further, kind of like tenderizing meat. So we actually go in there, turn this thing off of suction and break up the fat even further. So we melted the fat, then we break up the fat. After we break up the fat, then the last step is actually suctioning, okay? This is a 4 millimeter cannula and this is a 5 millimeter cannula. You can see the difference. This is the largest cannula we use. So the largest incision we ever have to make is a 5 millimeter. Typically, you can see on the bottom of this cannula there are 3 little openings, and when we're doing the liposuctioning, those 3 openings always go downwards. The skin being my hand and passing back and forth, we do the liposuctioning, suctioning the tissue down. All these things give us our best chance of not creating divots. The key to liposuctioning is doing it in an even fashion, planning out systematically what you're going to do, draw topographic mappings of the skin and tissue of what you're going to do, and then evenly take off and put in the exact same amount you're going to put in and take off on each side. Thank you.